Okay, hi Mr. Brown. My name is Riley. I'm going to be your nurse today. I'm just going to do a quick assessment, if you're okay with that. Do you have any questions before we start?
No.
I've already washed my hands, hand hygiene. So, first I would take his vital signs. I would take his blood pressure, take his pulse by holding here, watch his respirations. If I had an O2 monitor, take his oxygen and his temperature if I had a thermometer. And general appearance, he's got good, appropriate clothing for the weather. His hygiene, he doesn't have any bad smells or anything. He looks like he's eating well. Mr. Brown, do you know where you are right now?
Yes.
Where are you?
Home.
And can you tell me your name and birthday?
Mr. Brown, January 1st, 1990.
Perfect. And do you know what month that is?
Today?
Yes, right now.
April.
Okay. He's alert and oriented ×4. As he came in, I observed his gait. His gait is normal for his age and adequate for what he needs to be doing. Thought process is intact. Mood appears to be pleasant, perhaps a little uncomfortable. He's oriented. Thought process is appropriate. Can you tell me what you ate for breakfast this morning?
Cheerios.
Memory seems intact and insight and judgment are appropriate. Okay, so as I go through the assessment, I'll be assessing his skin color, integrity, look for any lesions, look for any edema, make sure everything is intact. So just from what I can see right now, his skin is intact, there are no lesions, consistent color and temperature throughout the body. So first we'll start with your head, face, and neck. So I am going to take your hat off if that's okay.
Okay.
And I'll put it back on after. So hair is evenly distributed along the scalp. Looks good, no lesions. There is one mark here on the forehead. How long have you had that for, Mr. Brown?
A year.
A year. It's about 1 to 2 centimeters long and it's red. It's got an irregular border. Other than that, he doesn't seem to have any lesions on his head or face. Facial hair is evenly distributed. And I'm going to assess your thyroid. Can I have you actually sit right here for that? So the thyroid, I'm going to feel right here, right underneath his Adam's apple. Can I have you look down and swallow? Thyroid moves equally on both sides bilaterally. No abnormal swelling. Temporal artery, palpate here on the side of the head. Pulse is equal bilaterally. Do you have any pain here on the side of your face?
No.
If you open and close your jaw.
No.
Perfect. TMJ. No pain, no abnormal swelling. Like I said, trachea and thyroid I already did. Do you have any pain here?
No.
Equal bilaterally. Okay, and I'll feel your lymph nodes here down the side of your face. Any pain there?
No.
Are you sure?
Yeah.
Pain here?
No.
What about here?
No.
And what about here?
No.
No pain, no abnormal swelling in the lymph nodes of the head and neck. Okay, you can put this back on. Thank you. And I'm just going to inspect your eyes. So, sorry that you can't see this very well, normal, but there's no discharge or swelling from the eyes. All the conjunctiva are pink with no abnormal swelling or lesions. Lacrimal apparatus is also pink, moist. Cornea, lens, pupil, and iris are all intact. They're equal bilaterally. Oh, I don't have my phone. Can I borrow it? Okay, I'm going to shine this light in your eye for a second. Pupils are equally round and reactive to light. The eyes are the same bilaterally. Red reflex is unable to be obtained because I don't have an ophthalmoscope, but the corneal light reflex is intact. Accommodation of pupils is equal bilaterally. Patient is able to see me up close. And, oh, here, can you tell me what that picture has in it?
Flowers.
And visual acuity is intact. Okay, and I'm just gonna hold my fingers up, and when you see one wiggling, tell me, but look at my nose.
That one.
Perfect.
That one.
Perfect.
That one.
Perfect.
That one.
Perfect. And upper.
Down. Can't even see that hand.
Just your eyes. Okay, the peripheral vision is intact. So for ears are equal bilaterally, about 3 inches long on each side. No notable lesions. No drainage from either one. No abnormal drainage. Tympanic membrane, I'll visualize it as well as I can. I don't have an otoscope. Tympanic membrane appears to be intact. And from what I can see, pearly gray with an average amount of earwax in there. Auricle and mastoid process, any pain as I press on those?
No.
No abnormal lesions or masses noted, no pain noted. Okay, I'm going to stand behind you and whisper a word, and if you can repeat it to me.
Hello.
And again. Little bunny.
Little bunny.
Okay. Patient passes the whisper test. Weaver and Rhine test, unfortunately, we can't perform because I don't have a tuning fork. But if I had a tuning fork for the Weaver test, I'd hit the fork and hold it to the top of my patient's head and ask if they hear it in both ears. That's normal. For the Rhine test, again, no tuning fork, but if I did it, I would hit it and hold it to the patient's mastoid bone. As soon as they couldn't hear it there, I would move it in front of the ear. If they can hear it in the ear longer than they can from the mastoid bone, then that's normal. Okay, Mr. Brown, we're going to move on to your mouth, nose, and throat. As I've been assessing him, again, been looking at the skin, all the skin on the scalp was normal with his mouth, lips, mucosa, tongue, uvula, and throat. All of that has been intact. It's all pink. I'll look inside. Say ah. It all looks intact, pink, and moist. And the nose has an average amount of nasal hair in it, and also pink and intact. And then I just right here. Any pain?
No.
Pain there?
No.
And I'm sorry, I'm gonna take your hat off one more time. Pain there?
No.
What about there?
No.
Perfect. No pain. Percussion yields tympani. Again, he's alert and oriented ×4. So as far as cranial nerves go, Mr. Brown, I'm going to assess those. So I'll just ask you a few questions. Let me grab my tools. Okay. Can you smell this?
Yep.
Perfect. Olfactory is intact. Sight is intact. Optic is intact. Oculomotor, trochlear, and abducens. Okay, can you follow my finger? Perfect. Here, here, here. Those are all intact. Okay, and will you close your eyes for me and just tell me if you feel this?
Yep.
Keep them closed.
Yep. Yep. Yep.
Perfect. Trigeminal nerve is intact. Okay, will you scrunch your face up really tight for me? Perfect. Facial's intact. We performed the whisper test already, so that means his acoustic and vestibulocochlear nerves are intact. Glossopharyngeal, we don't have any, oh my gosh, what are they called? Like popsicle sticks here. But if I did, I could test his gag reflex by having him open his mouth and sticking it back. Not too hard, very gently. If his gag reflex is intact, then his glossopharyngeal and vagus reflex, or cranial nerves are intact. And spinal accessory, will you shrug your shoulders for me? Okay, and down. And again. Perfect. That one is intact. And for the hypoglossal nerve, will you just stick out your tongue for me? As big as you can make it. Perfect. That one is intact. Great. Okay, and we're going to test your balance. We stand up for me. And stand with your feet together. Oops. Okay, now close your eyes. Keep them closed. Perfect. Okay, patient passes Romberg test. You can sit back down. Okay, and will you just stick out your leg for me? And take your other leg and run your heel up your shin. And back down, and up, and back down. And again on the other side. Perfect. Patient's coordination is intact. Will you close your eyes for me? Can you feel that?
Yeah.
Tell me if you can feel something.
Yeah.
Okay. The ability to sense light touch is intact. You can open your eyes. Okay. And then testing reflexes, again, we don't have all the tools here at home, but if I had a reflex hammer to test his biceps reflex, I'd have him relax here, grip his arm here, and hit right above the inside of the elbow. On both sides, patellar deep tendon, I'd have him sit on a little bit of a higher surface so his legs are dangling a little bit, and hit right below the kneecap on both sides. And Achilles deep reflex, we would have him have his legs dangling, grip the bottom of the foot a little bit lightly, and then hit right on that Achilles tendon to test and see if those are working. But I'm sure they're intact. Musculoskeletal, again, Gait was normal, balance is intact, symmetry of extremities, the extremities are all symmetrical. Mr. Brown, can I have you stand up and just bend over as far as you can to touch your toes? Perfect. Spine range of motion is full. And can I have you just move your arm around, bend your elbows and your hips and knees like this? Perfect. Range of motion of extremities is equal bilaterally and intact. Go ahead and sit back down. Okay, and as far as the respiratory assessment goes, looking from behind, he doesn't have any use of accessory muscles for breathing. The shape of chest is symmetrical. It's on a 2-to-1 ratio from back to front. The rate of breathing is about 16 breaths per minute. Depth is average and pattern is even. Okay, for assessing the breath sounds in all the lobes of the lungs, I'm gonna take my stethoscope and listen in a Z pattern down the back, zigzag pattern, to make sure I listen to all the lobes. Breath sounds are clear. And percussion, again, in a zigzag pattern all the way down the back. Great. Okay, Mr. Brown, do you have any tenderness as I press on your lungs back here?
No.
On your back?
No.
Great. No crepitus or fremitus noted with that. Okay, and then can I have you, switch to sitting right here for me? So for the jugular venous pulse and pressure, if the patient, can I have you lie down, Mr. Brown? I'm sorry. I'm going to be inspecting your cardiovascular system now. In a hospital bed, this might be a little easier because I can move him around a little bit. But in this reclined position, I'm able to see the external jugular vein pulse. And it's normal. But for the jugular venous pressure, since I'm unable to help the patient to lift the head of the patient up like in a bed, it's a little more difficult. But if I was able to do that, I would be on the right side and start with the patient flat with their head turned slightly to the left. And once I can see that external jugular vein pulse, you raise the head of the bed up until you can see that it's not quite, it starts to not be distended, like when they're lying down. And then the highest point of continued distension, the most cranial point, draw a horizontal line from that point, out above the patient's chest. And then you measure how many centimeters from the sternal angle to that horizontal line and add 5 centimeters, and that's the jugular venous pressure. And then, Mr. Brown, I'm just going to listen to your heart rate and rhythm. In all the areas of the heart. Okay. And before the video, I took his heart rate, and it was 64 beats per minute. If I hold the stethoscope here over his apical pulse for a full minute, that would be the same. No extra heart sounds as I go through. S1 and S2 heard, but no S3, S4. And then I will palpate the carotid arteries individually. So right here. So the rate is even, pulses are strong in both carotid arteries, and I'm just gonna check your pulses here in your wrist. Those are equal bilaterally and +2. And in the feet. Also equal bilaterally and +2. Okay, and then I'm just gonna assess your abdomen, Mr. Brown. So I'm gonna pull up your shirt a little bit, but we'll keep it as private as possible. Perfect. Okay, and for the abdominal assessment, coloration is consistent with the rest of the body's skin color. Vascularity, a few veins that are visible, but nothing super obvious. No abnormal vascular groupings. No scarring. His umbilicus is midline and is caved inward. Abdominal contour is normal. He does have one bulge here in the left upper quadrant. Is that painful as I push on it?
No.
No pain noted. It's hard and it feels like a bone. Movement of abdomen during respirations is normal, even, not labored. No pulsations or waves, and no ascites noted. Flat, none distended. Okay, so as I push on it, is that tender at all?
No.
Non-tender. And just slight muscular resistance, average. So then I'm going to auscultate all 4 of your quadrants. Start here in the right upper quadrant. Vowel sounds are heard in all 4 quadrants. And then I'm gonna listen over your abdominal aorta and renal, iliac, and femoral arteries. So here. Able to hear pulsing in the abdominal aorta. As well as the femoral arteries and iliac arteries. And can I have you, I'll listen to the renal on when he sits back up. No friction rub over the liver and spleen, noted. And then I'm going to percuss in each quadrant. Percussion is normal, dullness heard over the liver. Tone in all 4 quadrants is with dullness over the liver, a little bit in the spleen here. Bladder is now full, so dullness there. And the liver, I was able to percuss over the span of the liver, and the distance is about 4 inches. That's available to be heard coming down from the ribs. And then light palpation we already did, but deep palpation, just relax. Just tell me if it hurts. Patient is ticklish, so it's a little hard to do the deep palpation. But you get the idea. If the patient weren't laughing, then it would be easier to palpate in the right upper quadrant, the liver. Left upper quadrant is the abdomen, pancreas, and spleen. Left lower is just parts of the colon down here, and right lower is the appendix. So no tenderness there, correct?
No.
Or in any of them?
No.
Perfect. I can pull this back down. Unable to palpate the spleen, but able to palpate the liver. Aorta is non-palpable because the patient keeps laughing and flexing. And urinary bladder is non-palpable because it's not full right now. Okay, if I can just have you sit up, I'll look at your back really quick with your kidneys. Renal arteries are evenly pulsating. And then, do you have any tenderness there?
No.
What about here on this side?
No.
No tenderness noted upon palpation of kidneys. And that is it, Mr. Brown. We're all done. Thank you so much. Hopefully I didn't miss anything, but I'll come back to you if I did. Okay.